In Studio 97 this morning, Dr. Matt and Dr. Ben. Welcome, Doctor.
Thank you very much.
Doctor.
Thank you.
Doctor.
You need two.
Yeah, there's earlier. We're going to do something special today on me, is that right?
That's right.
Sir. All right, what are we doing? A hip replacement? What kind of doctors are you?
So we're doctors of chiropractic.
Okay.
And so outside of the traditional view of chiropractic, of the adjustment, we do much more things. We do acupuncture.
Okay.
We do a lot of rehab exercise. So teaching you what you're doing right and wrong at your desk or your workstation. But lastly, we do an advanced type of muscle therapy called active release,
okay.
which we're going to do some demonstrations today on you.
All right, good. So what do I got to do?
Do you want to try and maybe expose that one shoulder and we'll work on one side?
I'm not taking my clothes off for the camera though. There you go. What do you want to do?
So if you just want to have a seat right here.
Okay. This way?
No, we're just going to face right there.
Stand?
Sorry, sit here and face that way.
He has trouble taking directions sometimes.
Yeah.
Stand, sit.
No skin, Kane.
So generally what happens, just relax for me there. That's part one. Okay, so generally what happens.
Is this going to hurt?
No. Barely even feel it.
Oh! Is it in?
Oh, it's in. We're going to put one more in.
Okay.
Okay, so basically what happens, the needle goes in, and we're going to...
When's it going in? Tell me when it's done.
It's already in.
It's in?
There
That
we
didn't
go.
even hurt.
Okay, so this little, a lot of our patients call this the acupuncture gun. It helps stimulate the muscles to tell the muscles to relax. So what I'm going to do, I'm going to stimulate Sean's muscles to contract, okay, which he feels them jumping right now. Okay,
Yeah.
so usually we'll do this, okay, for a minute or so. Afterwards, okay, Dr. Ben or I will actually get on the muscle with our hands and do that manual therapy called active release therapy.
So what are you feeling?
I'm feeling like it's vibrating.
Yep. Perfect.
And it's kind of like if you're nervous or something. Really?
Yeah, by contracting the muscle, it actually relaxes it afterwards, and it's proven to hold up for 14 days just from this simple procedure. Then we add in the muscle work, then we add in the postural retraining, trying to fix you and reteach you how to sort of put your health care back in your own hands.
Wow. Yeah, it's kind of it's bouncing up and down, Orlando. That's what it feels like. Like kind of like your heart pumping.
Yeah,
and my shoulder.
So most of these injuries or ailments usually come from sitting at a desk for prolonged periods, because we tend to carry a lot of our posture. We bring our shoulders up and our shoulders come around forward.
So the needles are out, and then after something like that, and then we just try and relax your arm. The idea is that we're trying to stretch out the muscle and break up any adhesion or fibrosis or scar tissue that's within the muscle, which makes it tight and gives you pain. And the idea of these big muscles, they insert up into your neck and your mid-back and your shoulder. So if these are tight, you can get shoulder problems, neck problems, mid-back problems. Headaches, the whole thing, sort of like a question mark up the side of your head.
Wow. You know, these two doctors are well educated. You went to Western University, both of you guys?
We did.
And then you went to 4 years to where?
To the Canadian Memorial Chiropractic College. It's the only English-speaking school in Canada. 8
years after they graduated in '09, this is their #1 patient, they told me. How's my neck?
Your neck's tight because the muscle's tight. So the muscle comes from your shoulder up into your neck. So we've got to treat both, and the muscle will release quite nicely.
Oh. What does Orlena get done? Same thing?
Same thing, but she's a little bit more in her mid-back, and we work through some of the muscles there, and they're trying to teach her how to de-emphasize the muscle tightness.
I know you think, Sean, that you give me a pain in my butt, but actually it's not. It's a little higher. Yeah, I give you a pain in your neck, and mine's lower.
Now, is massage therapy part of your program too at university?
We do a lot of, it's sort of particular muscle work. I mean, there's a lot of massage therapy techniques into it.
Yeah.
But we're trying to incorporate movement, and we think the movement is a little bit more...
no skin, Kane. No skin.
And you can see the difference between that muscle and that muscle just with a quick sort of minute treatment there.
How's it feel?
It feels better already. Honestly, I feel better.
So generally speaking, with his shoulder, when we look at a posture, we see that this shoulder is hiked up and it's rounded forward. So we always address the culprit of what's going on. So we'll educate Sean and tell him that we have to keep the head nice and straight and back when you're at your desk setup, but we also keep that shoulder down and back That's our optimal position. So he also has a lot of pec tightness as well because everything he does at the radio station is forward.
How many
Makes
of us
sense.
actually have good posture on a daily basis? I would think that number would be very low.
It's an epidemic, really.
It is, yeah.
And the idea is that if you have tight muscles for years and years, then people start saying you have arthritis by the time you're 50, 60,
Yeah.
degenerative disc disease, all these big terms are mostly wear and tear from years and years of repetitive tightness.
Yeah.
So we fix that, we can prevent things, and that's what we're really trying to do is preventative healthcare.
All right, so preventive maintenance then.
Exactly. But the idea is that we'll fix you with the right exercises and change the way you sit, and then the problem doesn't come back.
All right, give me an exercise here so the people can see on Mixed TV what. Say, do you want me to pretend to have some weights or what?
Sure. Probably the best thing would be to stretch out your chest. So coming along the wall here and taking your chest here, then turning your body away. So rotate your body that way, and you feel the tension release down through here.
Yeah.
So the idea is with release here, it stops you being pulled forward, which stops the repetitive strain here.
Okay.
And then the other one, if you were to sit on your hand with your palm facing the ground,
Yeah.
okay, just one side,
Yeah.
okay. So if you sit up nice and straight, okay, relax that shoulder,
Yeah.
and let's take that right hand and grab this side of the head, okay. I want you to try to bring this ear away from the shoulder, okay. Do you feel all this stuff open up all through there?
Yeah.
Okay. So generally, what we can also do is try to relax that shoulder while we sit up straight and try to draw that shoulder down. Okay, so we're going to get a good stretch through there. Like Ben had said, okay, these muscles come up to the base of the neck. Okay, they're very, very common headache generators through here, behind the eye, and at the base of the neck.
So a good stretch is really good too.
That's for sure.
Absolutely.
Yeah, it's key.
Then in the gym, we want to try to strengthen these muscles
Yeah.
and try to counterbalance the big muscles you have in your chest and your
Give
shoulder.
me my what muscles in the chest?
Your big muscles.
Big muscles in the chest. Thank you.
Yeah, yeah.
How do we do a back muscle? Show me. You got a quick exercise? Or?
Yeah, so like Ben said, you know, a lot of us are overdeveloped here and we don't train our back very much. So when we do things like a bent over row with a barbell, or if we have a lat pull down when we're sitting down with a lat pulley, okay, the cable system.
The trick is to try and set that shoulder first and then do the exercise. So if you're doing the exercise rounded, you're actually teaching the wrong pattern.
Okay.
So set your shoulder blade here first and then move.
All right. Good stuff. Anything else you want to get in?
That's like, because the progression of it all, right? Get you out of pain, strip out the muscle, reteach you how to do it.
And
That's
where are
what
you
we're trying
at?
to do. 77 College Street West.
Phone number?
966-9500.
Hey,
Pat.
thanks for coming in, guys. Appreciate it.
Mix 97 FM.